You've probably heard the word appendicitis tossed around, right? It's often the first thing people worry about when they get a bad stomachache. But what is it really? Well, today we're going to break it all down and demystify this common medical emergency, step by step. But first, let's kick things off with a question. What do you think is the single most common reason people get rushed into emergency surgery anywhere in the world? The answer might surprise you, and yeah, it's the entire focus of our explainer today. You guessed it, it's appendicitis. So let's dive in. We're going to explore what this condition actually is, what that mysterious little organ is even for, and how it can go from being completely harmless to a major problem, seemingly overnight. Okay, so at its core, appendicitis is pretty straightforward. It's when your appendix gets inflamed. Just picture this small, finger-shaped pouch that hangs off your large intestine, usually in the lower right part of your belly. When that little pouch gets blocked and infected, well, that's when the clock starts ticking, and it becomes a real medical emergency. So what kicks this whole thing off? It almost always starts with a blockage. Think of your appendix like a tiny dead-end street. If something blocks the entrance, you're going to have a problem. The most common culprit is something called a fecalith, which is, just a fancy word for a small, hard piece of stool. But the blockage can also be from swollen tissue, or in some really rare cases, things like worms or even a tumor. Once that blockage happens, it sets off this really dangerous chain reaction. First, with the exit plugged, all the normal mucus and bacteria inside get trapped. They start to multiply like crazy, causing the appendix to swell up like a balloon. All that pressure starts to squeeze the blood vessels shut, which cuts off the blood supply. And without blood, the tissue starts to die. The wall gets weak, and it can burst. That rupture is the absolute worst-case scenario that everyone is trying to avoid. Okay, we know it's dangerous, but what would it actually feel like if this was happening to you? Let's talk about the classic warning signs your body sends out. This is the stuff you really want to pay attention to. Appendicitis is rarely just one thing, it's usually a whole package of symptoms. It often kicks off with you just feeling off. You lose your appetite, you might feel nauseous, maybe run a low fever. And then there's a really key physical clue called rebound tenderness. It's this weird thing where it hurts more when a doctor presses on your belly and then quickly lets go. But listen up, because this is the number one clue. The one thing you should absolutely remember from all this. It's the way the pain moves. Classically, it starts as this vague, dull ache right around your belly button. Then, over a few hours, that pain travels down and to the right, becoming a sharp, constant pain in your lower right abdomen. That journey is the classic red flag for appendicitis. So you've got these symptoms, you've done the smart thing and gone to the hospital. How do doctors figure out for sure that it's your appendix causing all this trouble? Well, honestly, it's a bit like a piece of medical detective work. So how do they crack the case? It's not usually just one test. It's a process of putting clues together from a physical exam, from your build work, and finally from getting a picture of what's going on inside. The investigation starts hands-on. A doctor will press on a very specific spot called McBurney's point. It's located right over where the appendix usually is. They'll also check for other strange signs, like Rovsing's sign, where pressing on the left side of your belly actually makes the right side hurt. It's weird, right? But all these little tests help them build a case that the appendix is irritated. Next up, they look for backup evidence in your blood. Now, a blood test can't say, yes, it's appendicitis all on its own, but it tells a story. A high white blood cell count means your body's immune system has sent out its soldiers to fight an infection. And an elevated CRP level is a general sign of inflammation somewhere in the body. Together, these clues make the suspicion a lot stronger. And finally, to really seal the deal, doctors need to see it. For that, they turn to imaging. An ultrasound is often the first pick, especially for kids and pregnant women, because it's super safe and just uses sound waves. But the gold standard, the most accurate test, is a CT scan. It gives a crystal clear picture of the inflamed appendix and can confirm the diagnosis, no question about it. All right, the detective work is done, the diagnosis is confirmed, it's appendicitis. So what happens now? Let's walk through the treatment and what the path to recovery looks like. Now, you might think surgery is the only way forward, but there are actually two main paths. For some really mild, uncomplicated cases, doctors might try a non-surgical route first. That means powerful IV antibiotics and just watching you very closely. But for most people, the standard and most definitive treatment is an appendectomy. That's the surgery to just take the appendix out. It solves the problem for good and prevents it from ever coming back. And even with surgery, there are a couple of ways to do it. The traditional open surgery involves one larger cut. But these days, what's way more common is a laparoscopic surgery. That's where the surgeon makes a few tiny little incisions and uses a camera to go in and remove the appendix. It's minimally invasive, which usually means you recover faster, have less pain, and way less scarring. So the appendix is out, and the focus shifts to recovery. You'll get some antibiotics to clear up any infection and pain meds to keep you comfortable. But one of the most important things they'll tell you to do is get up and walk around as soon as you can. It sounds simple, but moving around is absolutely crucial for preventing complications and getting you back on your feet quickly. So why do we keep calling this an emergency? This slide is why. If you don't treat it, the appendix can rupture, spilling all that infection into your abdomen. That can lead to peritonitis, which is a massive, dangerous infection of the abdominal lining. Or you could get an abscess, a walled-off pocket of pus. And in the worst case, it can lead to sepsis, a life-threatening infection that gets into your bloodstream. But let's end this part on a really positive and important note. Because while all those complications sound terrifying, the reality is if you get diagnosed and treated quickly, the outcome for appendicitis is excellent. The key is just not to ignore those warning signs and to get help right away. Okay, so let's do a super quick recap. Appendicitis is an inflamed appendix, usually caused by a blockage. The classic sign is pain that moves to your lower right belly. Doctors diagnose it with exams, blood work, and imaging. And the main treatment is surgery to remove it, which, if done early, leads to an excellent recovery. And that brings us to one final fascinating question. We've just spent all this time talking about how we can take the appendix out and millions of people live perfectly normal, healthy lives without it. So, if we don't need it, why do we even have one in the first place? That's a question scientists are still trying to figure out. Thanks for joining us for this explainer.